and welcome to this conference hosted by MS Focus, the Multiple Sclerosis Foundation. I am your host, Kimani Hendricks, Multimedia Communications Coordinator for the Foundation, and today I'm joined by Tiffany Malone, who will be discussing self-care and multiple sclerosis. After her presentation, we will leave it open for your questions and comments, but for now, let me introduce her. Tiffany is the director of the Dr. John Multiple Sclerosis Achievement Center and has been with the program for over 9 years. She oversees the development of program curriculum and the facilitation of activities and education to promote cognitive, physical, social, and emotional wellness for people living with MS and their loved ones. She has a master's of social work and is an MS specialist and has partnered with various MS organizations to provide education to people living with multiple sclerosis across the globe. Important topic. Tiffany, I won't take any more time, so I'll turn it over to you for being with us today.
Thank you so much. Thank you to the MS Foundation for having me, and thank you to each and every one of you for being here today. As Kimani had said, I am going to talk about self-care and MS. So let me get my slides up. And Kimani, can you let me know that you see that okay?
Yep, we can see
it. Yes.
Perfect. Perfect. All right, well, let's get started. If I can advance my slides. There we go. Okay, so today, let's start off by talking about the objectives for today. So my hope for everyone is that we learn different types and specific types of self-care. Oftentimes, we as mental health professionals and medical professionals may speak to you about self-care in a general sense, but we're going to talk about the specific types of self-care and kind of go over all of them and strategies for addressing many of the types. Also want to encourage you to learn strategies for managing and improving self-care effectively to promote your overall health and wellness. We working in the MS community know that patients and people living with MS are not exclusively living with MS. Perhaps there are other health conditions that you might be addressing. And so we want to talk about self-care as an advocate or a way to address overall health and wellness. I also encourage you to learn strategies to effectively communicate with loved ones or caregivers to support your self-care, and we'll go over those details. And lastly, to learn some available resources that you might not know of, and perhaps there are some that you know of that you have already utilized. So let's get started. I'm actually going to kick this off with a question. So I believe everyone has the opportunity to type into the chat, or if you do have the opportunity to type into the chat, and you would answer the question, how do you practice self-care? Just briefly, you know, whether it's exercise or meditation or something else, go ahead and type that in and we'll talk about some of those strategies. Please do that safely. If you're not in a place where you can type, no worries, because we're going to go over a lot of this. All right, so I see family and diet coming in. Yoga, fantastic. Tai Chi and acupuncture. Meditation, swimming. Oh, we got multiple swimmers out there. That's great. That is fantastic. And I'm curious if the morning meditation is swimming in the pool, because we can do both at the same time. It's a great strategy. More yoga, fantastic. Sleep hygiene. Oh, yes, that's a good one. Let's see. Exercise, fantastic. You guys are covering lots of ground. Massage therapy is quite therapeutic and great self-care. Reading, fantastic, a great hobby. We host a book club. For those of you who are reading, we host a book club. If you're interested, let me know. Give it a couple more seconds. Healthy eating, yes. Rest breaks and art therapy. I love that. I love the art therapy component. And of course, the rest breaks are crucial to all parts of our care, right? And physical therapy, fantastic. Feel free to keep chatting if you haven't had a chance to answer that question, but thank you to those who did. And if you didn't have a chance to type it in, at least think about how you consider your own self-care and how you consider you to practice that self-care. But let's switch gears now and let's answer the question. I'm not sure why this is working the way that it is. There you go. What benefits do you experience when you practice self-care? What do you feel like you benefit? How do you feel like you benefit from self-care practice? And again, you can go ahead if you are able to safely chat that into the chat box. We've got people who are doing hobbies and going on a roll with the dog. I love that. Pedicures, listening to music, and that it decreases stress levels, decreases the flare-ups, relaxes the mind, decreases tension and stress, gives us a sense of well-being. Yes, and relaxation, and that you feel more in control. Ooh, that word's going to come up throughout our discussion. Feeling of control over your body. Yes, again, that's a very important word that we're going to talk a lot about. Lots of decrease in stress and anxiety. So it sounds like not only do you know how you're practicing it, but you know why you're practicing it and how it benefits you. We've got more energy, more focus, allows you to show up for your family. Keeps me sane. Short and sweet. I love that. A calm start to the day, relaxation. It helps you sleep better. Absolutely. And understanding what's needed and when. These are fantastic answers. And thank you so much for your participation with that. Feel free to keep chatting. I'll look back at that and we'll incorporate that into our discussion. So if you didn't know already, let me share with you that there are different types of self-care. There are different categories that we kind of put self-care into, or how we break it up. And perhaps you think about self-care in one or some of these categories, but perhaps you don't recognize it in all categories. So let's go over those, and then that'll carry through our discussion for the remainder of this presentation. The physical type of self-care. That's the eating healthy that some of you mentioned. That's the exercise that was mentioned. That's the physical therapy that's mentioned, the swimming that was mentioned, the sleep that was mentioned. So it sounds like our group here is definitely focusing on that physical component of self-care. We also have the mental component, which includes mindfulness, perhaps meditation. I know that comes up again in a spiritual category, but meditation can fall under this category. Talk therapy or counseling falls under this category. The emotional type, which includes things like looking at positive ways of thinking, finding the gratitude in the day. If you don't know me already, I am known as the Gratitude Queen here in Sacramento and in our environment at the Achievement Center. Because that's a thing that I think that is very important for all of us, is to be able to recognize our gratitudes each and every day. We also, on the flip side, need to know what our triggers are, what causes us to get into a negative emotional or headspace. And so to know those things and try and build boundaries around those things. And we'll talk more about that. And journaling is a type of emotional self-care that works for some people, where we're writing down our emotions or our thoughts and having them in a safe place that we can keep or not, or get rid of once we got them out of our head. So journaling can be effective as well. Under the spiritual category, we've got things like meditation again, being out in nature perhaps, things like yoga and Tai Chi would fall under that category. The intellectual category, which is the learning something new, or things like our hobbies of reading and being able to continue with something that we're passionate about even with some challenges in place, and participating in those hobbies, those things that we love to do. The environment is really important, and I don't know that we always think about this, and maybe we do, but in a sense of self-care, is my environment safe? If I'm going to go for that walk or roll with the dog, am I going into a safe environment where we're all going to be safe, where I'm going to have access to a sidewalk that I can use safely, or a part of the street that would be safe? Is my neighborhood safe? Is there a park that I need to get to first for that to happen? And clean too. We want to make sure that we're living a healthy lifestyle and being in a clean and safe environment. The social piece is also very important. This is where we build that connection with loved ones, with friends, with a variety of people throughout our day and throughout our week, and how we're connecting with those. And are they positive connections? Are they negative connections? Are they important? Are they vital? Are essential to our well-being? And then building boundaries around some of those connections as we need to make them healthy and safe and a positive experience. And then the financial type, which includes budgeting, saving, looking at what money is coming in and what money is going out, and how we might need to make some changes to that to benefit us for our current needs, as well as future needs as we're becoming more aware of them and that they're needed more. So are we comfortable and able to finance those things? So as we move forward, you're going to see in the top right-hand part of your screen, you will see one or more of those self-care types. Not to say that all of these are very limited, because I think all of these categories can go under any of our discussion moving forward today, but it kind of gives you a sense as to what we're focusing on. So let's talk about that general health and wellness. One of the first things that I talk about with people living with MS is, are you keeping your appointments? And not just your MS related appointments. I know, and we as medical professionals know, that patients living with MS have 1,000 appointments. You have your lab appointments, your imaging appointments, your specialty appointments with neurology, the physical therapy that may be ordered for you for different changes that you might have that might have occurred for you. And that includes other things like occupational therapy and speech therapy. So your calendar can be already inundated with just the MS stuff. So it's hard sometimes to keep the other things in order. So the routine appointments like annual physicals and other annual tests that might need to be done based on your individualized needs and health status. But are we making those appointments, and are we keeping those appointments? That's a really important two-part question, because it's one thing to make them. It's a whole other story if we're keeping them and following through with our treatment plans. Knowledge is power. So it's important for us to know what's going on. It's important for our healthcare providers to know what's going on so that we can be part of that treatment planning. And then in addition to that, are we taking our medications as prescribed? When I speak with people about medications, it's always interesting to hear the responses, because I hear everything from I'm taking them exactly as they are prescribed diligently to I think so, I'm not sure, I don't really know what this medication is, and sometimes I forget my noon meds. And so there's a lot of answers that fall into that spectrum. But it's really important, especially as we're reporting back to our healthcare providers, to be able to say yes or no to this question of, am I taking them as prescribed? And do I know how they're prescribed? I've worked with some patients who have said, I didn't realize that I was supposed to take this on an empty stomach. Haven't done that for 8 years. That's an important thing for your healthcare provider to know, because it may affect the efficacy of that medication. And you may think that it's not working. However, if we're not taking that as it's meant to be taken, then that could be causing the difficulty. So we want to be able to give and receive correct information. And if the medication prescription or dosage or time of day that it's being asked of you to take, perhaps if that doesn't work for you, to go back to the healthcare provider that prescribed it or your pharmacist and ask, is there anything else that I can do that would work more effectively for me? The schedule isn't working, and I wonder if there's another option. To have that line of communication open is really, really powerful for you, can be. And the other thing to talk about in this category is, have you completed an advanced healthcare directive or a POLST, which stands for Physician Authorization for Life-Saving Treatment? These are documents that will follow you in any medical office. Once you give the copy to your provider, they will keep it on file. It's something that you might want to have a copy with you at all times in case of an emergency, in case you need to go to the hospital, you would want to take this with you. But these are documents that you would complete today, now, if you haven't already, about how you would want your treatment to be provided, if at all, in the event that you're not able to verbalize that in an emergency situation. So it asks things like, do you want to have treatment provided? Do you want to have life-sustaining treatment if that's in question? Do you not want that to happen? And then ask other questions such as like organ donation and things of that nature. It also asks you to assign an agent, meaning who would be in charge of making those decisions on my behalf if there's another question that hasn't already been answered on that document. And you would name that person. These are important documents because we go back to that word control that came up a couple of times when I asked the polling questions. This puts you in control, even in a time when you wouldn't be in control or wouldn't be able to actively participate in answering those questions. You would have already made those decisions for yourself, and those would be followed through by your healthcare provider at the time that it's needed. So this is a great way to think about, let me make the decision now, and that way I don't have to worry about who or how that's going to be answered if there were to be an emergency. So if you haven't already completed one of those documents, I encourage you to talk to your doctor about that. And then let's move on to more of the mental type of self-care. And one of the biggest things that will impact how we think, how we feel, how we act is what's going on in our head. I call that head chatter. You may have heard that before, but it's the stuff, the information, the rumors, the concerns, the what ifs that float around in our head that may distract us from our present moment. Now, I'm not here to say that you should ignore or dismiss any negative thoughts. What I would ask and encourage you to do is to find out where they're coming from. Whose voice are they? Is it your voice? Is it someone else's voice? And is it actual information that's helpful to you? Or is it head chatter that's causing, again, distraction and keeping you out of control of your day-to-day tasks? And so can we think about things in a more positive light? In some cases, absolutely. In other cases, perhaps it's a way to question, why am I holding on to these thoughts? Where are they coming from? And again, whose voice are they? So that I can decide, is it helpful? Do I need to keep it? Or do I need to change it somehow? Do I need to get rid of it? That's when talk therapy can come into play. That's when counseling can be helpful. And that's when reframing our thoughts can be helpful. If I have this negative thought, but it's coming from someone in my past and it's not doing me any positive good, and I don't need it right now, then why am I holding on to it? Am I willing to dismiss it or to put it somewhere else? That's where journaling can also come in handy. And why is all of that important? This diagram shows that what we think will turn into what we believe, which will turn into how we feel, and that will turn into how we act, how we behave. So if we've got negative thoughts that we're carrying around on a consistent basis, we're going to start to believe those thoughts. So not only are they going to be words that are in our head, they're going to turn into, I believe that to be true. And over time, that's going to affect how we feel. And if we're bombarded and overwhelmed by these negative thoughts or these thoughts that are not productive for us, and we've now turned those into beliefs, now that's how we're going to feel. And so we're going to go throughout our day with those feelings of negativity, from that previous slide, of the head chatter, of sadness, of depression, of failure. And again, how productive is that being for us? Because then that turns into how we behave with our own actions, with our own self-care, with our own decisions about how we're going to treat today, how we behave with others, how we behave with our loved ones, caregivers. If we have any loved ones or caregivers on today's presentation, this absolutely affects all of us, no matter where we are in life. So that would turn into how we behave with the person that we're caring for. And that can be unproductive, that can be negative, and it doesn't put us in a place that I think our overall goals would be. And so it's important that we're mindful of that. At the bottom here, it says you can't live a positive life with a negative mind. And that's absolutely true. Because again, those thoughts and those feelings come before the actions, but they will dictate the actions. So let's take a step back and let's talk about communication, because this comes into play with any type of self-care. And I'm going to talk about communication as communicating with ourselves. So going back to that previous slide, thinking about your thoughts and your beliefs and your feelings. So what are we communicating with ourselves, to ourselves? And how are we communicating with those around us? I don't want this to turn into a presentation on communication, but I do want to give you some background information about the different types of communication and how our communication can be perceived by somebody else. So if you look at this diagram, you'll see that a huge part of communication is our body language. It's how we're behaving. It's how we're presenting ourselves. 55% of our communication is just that. So that's a majority of how we're communicating. So are we checking in with ourselves about what that looks like, how that feels, and how that might be perceived by somebody else? The next category is your voice, your tone of voice. And this, I'm also going to throw in how we're communicating. So is it via text? Is it in an email? Is it electronically in some fashion versus face-to-face? Because that tone can be perceived in a different way electronically than it is in person. So again, what is our intention and how do we think we're coming across? That's 38% of our communication style. And then 7% is the spoken word. 7% are the words that are coming out of our mouths, when the rest is voice, tone of voice, body language, behavior. Okay, so it's important again to check in with ourselves to know how we sound to ourselves and how we're talking to ourselves, and is it in a positive and productive manner, and then how we're speaking with others. And some of the obstacles to communication can limit our communication or influence our communication. Things like denial. Nothing's wrong, everything's fine. I don't need to talk to a doctor about that. I don't need to talk to a loved one about that. So I'll get to self-care when I can. I've got plenty of time for it, even though it doesn't seem to happen very often. Lack of information. Our communication can be influenced by not having enough information. Conflicting coping styles. Perhaps the person I'm speaking with is coping differently than I do. And so when we cope differently, then we receive information differently. We're in a different headspace. We might have different chatter going on. We might have different self-care strategies that might not match up exclusively. So being mindful of the people that we're communicating with. There may be shame or embarrassment. I don't want to have to admit that there's perhaps a flare up. Perhaps something else is wrong. No, I only have MS. I shouldn't have to have anything else. So that can influence our communication style and how we approach things like self-care. The lack of time or place. I don't have time to tell people that my calendar is full, or I don't have time to tell people, or I don't have the availability to tell people no, because they won't accept that. So being mindful about that as well. Mood can influence our communication and ultimately our self-care. Again, back to those thoughts, beliefs leading to how we feel. Our mood can absolutely be an influencer. And then certainly cognitive challenges. Did I tell that to somebody? I don't remember. Did I write it down? Where did I write it down? It was on that Post-it note that got stuck to the shoe that now is somewhere on the street. Things of that nature can influence. And so being mindful about how we're communicating with ourselves first and foremost, and then communicating outside of that. And this one talks about it's okay to not be okay. It's okay to have a moment of denial. It's okay to say I don't have enough information. It's okay to say I'm embarrassed to talk about this. It's also okay to be vulnerable and to allow ourselves the time and space to not be okay, but then to figure out, what do I need? Do I need more time? Do I need more information? Do I need a minute to be sad or afraid? And that's okay. What I would encourage you to do is be mindful about how long you're allowing yourself to not be okay. And if that's becoming a pattern of behavior, if that's becoming your coping strategy, then to be aware that perhaps that's gone on for too long, and now it's time to reach out to someone and say, I think I need to talk to somebody. Okay. And usually the question about that is it lasting persistently for more than 2 weeks? And if it is, might be time to check in with somebody. And one of the things that I like to talk about a lot is the emotional backpack. Imagine that you are carrying a backpack on your shoulders. No cheating, no putting it on the back of a chair or on the seat of your walker. Everybody's got to carry it on their shoulders. And imagine what it would feel like if we started to put rocks in that backpack. And more rocks. And even more. I imagine that perhaps you're thinking, gosh, this is getting heavy. I'd like to put this down. And this is what I mean by the emotional backpack. The stuff that we don't deal with, the self-care that we don't do, the thoughts and feelings and beliefs that we carry that are not productive to us. If we don't do anything with them, then they're stuck with us and we're carrying them around in somewhere, whether it be on your shoulders, whether it be on your heart, in your soul, you're carrying it around somewhere. And eventually that's going to be so overwhelming and too much to handle, if you will. And so it's important that we're constantly checking ourselves by things like doing yoga and meditation and Tai Chi and swimming and reading, so that we can make sure that we're introducing that healthy emotional state into our world and not carrying all the rocks. Okay, we want to balance that out. Let's see. So I often will say to people, check in with yourself. And I've had people ask, what does that mean exactly? What does it mean to check in with yourself? And it means exactly this. Stop. Stop the head chatter. Stop the activity. Stop the overwhelming schedule. Stop the overwhelming backpack that you're carrying. Stop and take a break. I know that was one of the things that came up as far as a self-care activity that someone shared is taking breaks. It's absolutely imperative that we take a break. And if for no other reason but to take a nice cleansing deep breath, it kind of gives us the opportunity to start over or to start from there. But to pause that feeling of being overwhelmed or being anxious or being afraid or being sad. It's not going to dismiss it. It's not going to make it go away. But just for a moment, let me check in with myself and see what is actually going on. And if that visual doesn't work, hopefully this statement will. If you don't know how to be present in the moment, I call that be here now. If you're struggling to check in with yourself or take a break, remember this statement, and it's that your breath and your body are always in the present moment. Your breath and your body are always in the present moment. Now, you may not feel that they're in your control, but they will always bring you back to where you are in that present moment. And so if you're struggling to take that break or to stop and take that breath, stop and ask yourself, where is my body right now? And that will focus your attention on where you are in any moment. Because oftentimes what I learn from folks is that we're stuck in our head about the what used to be and what could be. And when that takes over, then we do get distracted and we are down that negative rabbit hole. So this gives us the opportunity to bring ourselves back to that present moment. Your breath and body are always in the present moment. I encourage those of you who meditate to use that as a mantra and see if that's helpful for you. This slide talks about protecting time and energy. This is something that where I have put on here that it says I can do hard things. I believe that you do more than that. You are doing the hard things. I know that it's not easy living with MS. I know that every day can be a challenge. And so I know it says that I can do hard things, but I know that you're already doing them. Now, how we can do that effectively and again, productively is by prioritizing. Are we prioritizing ourselves? Are we prioritizing our self-care activities? Is the swimming on the calendar? Is that a protected time? Is the reading on the schedule? Is it a protected time? And if not, am I willing to make it a priority? Am I willing to make me a priority? And if not, how do I reprioritize? What needs to shift? What needs to move? Recognize and credit yourself for your accomplishments. Give yourself that pat on the back. Give yourself that hug and say, you know what? You did that. You got up today. You did that. Good job. Because we don't always have someone who's cheering us along. So we have to be our own cheerleaders. And that's an important place to be, because when we're proud of ourselves and we recognize ourselves for any accomplishment, then that body language changes. I have more confidence. I feel like I'm in control. I feel more positive. And now I can be available to my family, to my loved ones, as was stated earlier. It's okay to say no, and it's okay to say yes. So this is where we look at boundaries. This is where we look at boundaries for ourselves. And this is where we look at boundaries that we establish with other people around us. Am I building time and space and the ability to provide, to dedicate energy toward my self-care activities? So I'm going to say yes to that. And that may mean that I need to say no to something else that's offered. But that's okay, because if I look at the priority the priority is me. And I need to do that first and foremost, and the rest of the stuff afterward. And it's okay to be flexible and say, okay, so if I don't do my reading today, or I don't get to my reading today, but I got to say yes to another event, I'll make sure that I get back to my reading schedule tomorrow, or my swimming schedule, or my exercise schedule, or my meditation schedule. I'll get back on track. But that's where that flexibility of prioritization can come into play. If we self-reflect and we recognize that we're a person that says no to everything or most everything, perhaps reflecting on why. And what I often hear is, well, I don't know if I'm going to be feeling up to it at the time of the event, so I just say no. And if that's working for you, okay. But if you feel like you're missing out on stuff, if you feel like that social connection is missing, perhaps trying, I'm going to RSVP yes, and I'll let you know if that changes when I get up that day. Yes, it is a possibility that I'm going to have to cancel, but I'm going to commit to it and give that disclaimer. On the flip side of that, if you're a person that's saying yes to everything and you're overextending yourself and you've said yes to everything on Tuesday and for the next 2 days you're down for the count, was that worth it? Could there have been some different balancing, some different flexibility that you could have practiced? Those are questions to ask yourself. On the days that you feel great and you want to get as much done as possible, just be mindful about how that's going to affect you and how you're going to be able to say yes or no to future events later on in that week. So looking at the calendar as a whole, looking at your activities as a whole, looking at your priorities as a whole, and adjust and modify as you see fit and as you need to. And before we get into questions, I want to throw out some resources here. This is not an exclusive list by any means. These are 2 resources that we use at the Achievement Center and have for various different activities. But Calm is an app, and you can use it online as well, that offers free mental health resources. So if you were to click on there, there is a program that they have that's free. There's also a paid subscription option, but there is free content that goes over things like grief and depression and sleep hygiene. And so it's really nice to be able to have that as a possibility. This is from a more meditative perspective, but people will find different ways to use that, whether it's to calm down at the end of the day to get ready for sleep, or to wake up in the morning and feel refreshed, or if you need it as needed for different thoughts and emotions that you might be experiencing. And I want to introduce the Balance app. Again, this is, there is an option for a paid subscription, but because May is Mental Health Awareness Month, and I believe today is actually National Mental Health Awareness Day, so yahoo for us for celebrating together. The Balance app is offering a free 1-year subscription to anyone who signs up. So if that's something that works for you, try it out, see if you like it. You would have a free year. And I believe that's like an $60, $70, $80 subscription per year that would be available to you for free. I don't know when the cutoff date for getting registered for that 1-year free subscription, but I know they're doing it in this month because it is Mental Health Awareness Month. So those are 2 possible resources. I know there are a ton more out there, and I invite you to explore what works best for you. I think someone had mentioned in the chat, I don't remember which one, but someone had mentioned an app that they use. So find one that works for you, but I wanted to make sure that we did talk about those 2 specifically. So I know that there's some questions that I think have been fielded already, but I will open this up. Kimani, you want to tell us what the next step is for questions?
Yes. I do. First of all, thank you for the presentation. It was awesome. I love the interaction and the polls. It was great. We don't get that too often, so it's always a treat when they can participate during the presentation. So if anybody has questions or comments, like most attendees on Zoom, you can either continue to put your questions and things in the chat or the Q&A section. If you're watching us from Facebook, there's always the comment section on the live stream. I think I saw something from Anne a few minutes ago. I think she was just addressing the crowd here, but maybe you can offer some advice on what she said. She said, does anyone else feel they push themselves because they don't want to disappoint others?
Oh, see, that's where that shame and embarrassment comes in when that was under the slide about the obstacles of communication. And that can be a real challenge, especially if your loved ones or the people around you are seeing you as the version of you prior to your diagnosis. And I know that no matter how long you've been diagnosed, that is in the back of many people's heads, if not all, who are living with MS, that there's that expectation by loved ones and those that are familiar with us that say, but you used to do this, you know, so much faster, or you used to take on all of these tasks. Why not now? And to protect yourself, you often will say, oh, I've got this. I totally am the same person. And again, that goes back to that communication of, am I being truthful with myself first and foremost, and with others? And if they don't understand the why, which is a big barrier to overcome, and I know that, then be specific about the what. I have this time available. I don't have this time available. You don't necessarily have to explain all the ins and outs. And I know that becomes confusing and challenging for people because we always want the whole answer. But sometimes it's just best to say, this is what I have available. Does that also work for you? And being very clear about the what versus the why, especially if it's not a person who has shown the interest or ability to understand the why. You can exhaust yourself trying to explain MS. You can exhaust yourself trying to explain the symptoms and all of that. And I wish that we had the magic wand to make everybody understand. And unfortunately, that's still not available to us. So until then, let us protect ourselves. Let us build those boundaries for ourselves, and feel confident in your control of being able to do that. Not necessarily confident in your ability, but you're confident in your ability to be in control of that decision. I hope that answers what they're asking.
I hope so too. It made sense to me, you know, and you talked a lot about communication, and oh my God, it's not just talking. You also have to hear them, and not just hear them, but comprehend what they're saying. And you're right. A lot of time people are like, oh, they have these definite opinions, but they don't understand what it is you're saying. You can say it 5,000 different ways and they still don't get it, right? And you're just so frustrated because you want them to understand and they just don't. So yeah, that's boundaries. I think it's hard for some people, you know, they want to please everyone. They want everybody to get it. They want everybody, you know, I kind of suffer with that a little bit too. And I'm learning to draw lines for sure. Right now, I don't see anything else in the chat. Bavia, is there anything on Facebook? I did want to thank you though for bringing up Mental Health Awareness Month, because it is timely that we are having this discussion. And I don't think that it can be overstated, but it was something that I did not realize until like maybe a year or two ago, but that mental health was physical as well, you know, and how we talk about ourselves or other people or how we treat them. It's just so, oh my God, it can really manifest physically. Like if we talk negatively or positively, it really does make all the difference in how we feel too. So for sure.
So I want to speak to something that was written in chat. It's not necessarily a question, but I'll just speak to it. someone said, I push myself because I don't want to admit to myself that I'm changing and what I can do. And again, that's where that communication has to start with us. It has to start internally, to say, what am I telling myself? And to learn how to be okay with things looking a little bit different or a lot of it different in some cases. And that's where I go back to that, be in the present moment. Let us not focus so much time and energy into what used to be true for us. None of us look the same that we did 20 years ago. None of us look the same as we did last year. There have been changes. No matter what our life journey has been in that, no matter what part of where we are in our journey, I will find words, I promise. But also being able to, once we recognize that and accept that, I'll talk about acceptance in a minute, then we can take that control and communicate that to other people. And that's where those boundaries can come into play. And acceptance, I say that and a lot of people are like, oh, that's a dirty word. It is a dirty word, but it does not mean that we have to agree with what's happening. It does not mean that we have to like it. It means that we will work with it. And if we learn how to accept where we are in the present moment, where our breath and our body are, then we can take control and have the confidence in taking control over the decision of what do I do next.
Yeah, I remember speaking to someone, a therapist who practiced in CBT, and she was talking about something I think is called radical acceptance. You know, people really don't like the sound of that because they think like, oh yeah, well, this is happening to me. And even though this is something bad, oh yeah, that accepting, if I accept something, that means I'm enjoying. Yeah, you're right. I think that it has a lot to do with taking power back and having some semblance of control over the situation. Like you're not going to be able to control everything in life, but you do have to accept things. And sometimes it's harder to accept things. It's a process that varies obviously depending on the person. And with managing a chronic illness that is not one size fits all, it's difficult for sure.
Yeah.
But Bobby has said no questions, but a lot of thank yous. In the chat. I don't see anything in Q&A. This is so timely, and I'm grateful to have been part of this here. There are some people talking among themselves, which is
I know, I
good.
love that. I love the
But did you have
interaction.
anything else to add?
I just looked, there was a Q&A. Let me see what this says. Can someone be too
Oh,
positive
there is
or not
one.
view the reality of the situation? Yeah, so can you be too positive and can you be ignoring something? And I think that yes, that is absolutely a possibility. But again, if we stop and take that breath and check in with ourselves and say, okay, am I missing something? Am I avoiding something? And have I stuffed it in that backpack and I didn't realize I had stuffed it in that backpack because I was trying to be a positive person? Then yeah, we can miss something. But if you are a positive person and it's working for you and you're still addressing all of your needs and you feel like you've got a balance, then I'm not going to stop you from that. No way, Jose. And I like the comment that was also made about it's okay to be grateful. It's okay to say thank you. Going back to communication style, I think that it's important that we do say thank you and mean it. That goes back to that nonverbal communication. If I'm saying thank you, but I'm off and I'm distracted and I'm not really meaning it, it's not going to be received by the other person as a genuine gratitude. So be okay to say thank you and be okay to accept a thank you.
We have a question from Jody. She said in the beginning it was mentioned there is an MS book club. Where can she find it?
So the MS Achievement Center in Sacramento has a book club that's offered virtually. It's once every other month. And so if you want more information, what's the best way to do this, Kamani? I can give you an email address or we can take down Jody's information. What would be best?
I can type that email address into the chat if you want. and then she can take it from there.
Okay, so it's Lacey, Lacey .Sayer, Sayre at commonspirit.org.
Did you say common?
Commonspirit.org. And for anyone who's interested, please email
There you go,
Lacey and she'll get you on the distribution list and you will get all of the information about the book club. All the dates are set for the year. All the selections are set already, so we can get that information to you. That's not a problem. For the person who said the
And,
backpack visual was
Jody,
excellent, I've used it a ton.
Jody, I just wanted to address something that you did say a few moments ago. Yes, you will be able to rewatch the presentation on either our Facebook page. After the live stream is over, it will just load and you'll be able to look at it from the beginning if you did miss it.
And Carly, I got your information. I will make sure you're added to our lists.
So, well, this was so helpful. And if there are no other questions or comments, everybody thank you. Awesome. So as I said, if you guys have missed any part of the conference, please visit the Multiple Sclerosis Foundation Facebook page. And within a few days, about a week or so, it will also be up on our YouTube channel. Our next teleconference will be Thursday, the 23rd at 7 p.m. Eastern Time with Megan. We'll be discussing how to manage MS symptoms, and I think specifically she'll be talking about conventional and integrative management. I believe that we also have surveys wherein you can tell us how we did, give us feedback, and also share with us any ideas that you would like to see presented in future webinars on Zoom. We would greatly appreciate that. And we just thank all of you for your participation, your questions, your comments. I don't think I'm missing anything, but Tiffany, thank you so much for presenting. I don't have chronic illness, but there are some notes that I was taking as a result of this talk. So thank you so much.
Thank you. Thanks to everybody who joined. I appreciate it.